My name is Belinda Ratter, and I'm presenting today on Parkinson's disease. Parkinson's disease is a neurodegenerative disorder that affects the neurons that produce dopamine. Symptoms begin slowly and gradually worsen over time. The cause of the disease is unknown, and there is no cure for the disease. Treatments focus on managing the symptoms. Dopamine is a chemical messenger that is produced in the hypothalamus. It is responsible for the feeling of reward and pleasure. It controls movement, sleep, learning, and concentration. In Parkinson's disease, the nerve cells that produce dopamine progressively die. Types of Parkinson's disease include vascular Parkinsonism, which is caused by a restriction of blood flow to the brain. The part of the brain affected involve movement and speech and develop rapidly and cause the Parkinson-like symptoms. Idiopathic Parkinson's is the most common form of the disease. A prolonged use of antipsychotic and neuroleptic medications can cause drug-induced Parkinson's because they regulate dopamine. This type of Parkinson's is usually reversible once the medication has been discontinued. Corticobasal degeneration is a rare form of the disease. It occurs when there is a buildup of the tau protein in the brain. Corticobasal degeneration develops slower and often usually affects one side of the body first, then slowly impacts the whole body over years. Most people with this type of Parkinson's are diagnosed with this between the ages of 50 to 70. There are 5 stages of Parkinson's disease. The initial stage begins with a tremor and is minimal. In this stage, activities of daily living are not affected. During the second stage of the disease, symptoms start to impact the entire body and activities of daily living take longer to complete. Tremors increase and facial expressions start to change. Loss of balance and coordination become affected in the third stage of the disease, and daily activities become difficult to perform. During this stage is where patients begin falling. In the fourth stage of the disease, a person is no longer able to live alone, and they require assistance with daily activities. In the last stage of the disease, dementia, confusion, and hallucinations begin at this time, and a person is usually confined to their bed. Early symptoms associated with Parkinson's disease include a development of a tremor, loss of smell, changes in handwriting, sleep disturbance, stiffness in muscles, constipation, voice changes, a masked facial appearance, dizziness, and stooped or slouching posture. As the disease progresses, other symptoms such as reduced arm swing, shuffling, short gait, and flexed knees and hips begin. Because Parkinson's disease affects the enteric nervous system, the gastrointestinal system is impacted. Patients experience constipation, pain, and decreased gastrointestinal motility. The involvement of the vagus nerve creates the symptoms of behavioral disturbances such as anxiety, depression, and pain. The causes associated with Parkinson's disease include genetic mutations, environmental exposure, the presence of Lewy bodies, and the presence of alpha-synuclein found within the Lewy bodies. Risk factors include age. So the disease usually develops over the age of 60. Gender, as men are 50 times more likely to develop the disease than women, and exposures to toxins. Complications include sleep disturbance, cognitive disturbance, orthostatic hypotension, sexual dysfunction, fatigue, and pain. Treatment focus on symptom management include medications such as carbidopa-levodopa, inhaled carbidopa-levodopa, dopamine agonists, carbidopa-levodopa infusion, COMT inhibitors, MAOI inhibitors, amantadine, anticholinergics, and deep brain stimulation. A deep brain stimulator is a surgically implanted device that sends electrical impulses that work to regulate the fluctuating levodopa and control dyskinesia. that medications are unable to control. Alternative treatments include massage, yoga, pet therapy, Alexander technique, meditation, and Tai Chi. Home remedies include daily exercises that focus on balance, strength, and flexibility, and eating healthy diet that is rich in omega-3 fatty acids. Thank you.